Hi, Mary.
Hi, Lizzie.
Welcome to our very first episode of today's anatomy question. Mary Richards is joining us. She's our guest expert who is completely overqualified for our question today. Where are you joining us from, Mary?
Alexandria, Virginia.
Okay, and I'm in Munich, Germany, so we're talking through the magic of the internet. I wanted to introduce you, if I could briefly, Mary, and then we'll get started talking about dog pose.
Great.
Mary Richards has been a yoga practitioner since 1992 with a study primarily in the Iyengar tradition. She has been a student of my mama, Judith Hansen Lasater, for more than a decade and serves as Dr. Lasater's lead therapeutics and anatomy teaching assistant. And Mary and Mom are working on a course that I'm producing that's coming very soon from our new platform, Lasater.yoga. So we're so excited to welcome Mary into the teaching family. And I'll just read the last sentence of your bio, which I absolutely love. Mary is a member of the Phi Beta Kappa Society. She studied international affairs, magna cum laude, and the International Association of Yoga Therapists. So welcome.
Thank you.
The question today is a pose that we do so often in yoga classes and when we practice at home. I wanted to ask you about dog pose and specifically about the shoulder joint in dog pose. There's so often I hear this instruction about rolling the outer upper arm bones in, which I feel a kind of crunchy sensation in the neck and in the upper back. So what's your take on that? What instruction do you give when you teach, and what's going on anatomically, physiologically in that region, in that pose?
Well, first, I just want to tell you how much I enjoy this question, and it's one I've heard very frequently over my decade and a half of teaching. And the answer to it is it's not black and white, okay? So first, we need to understand range of motion and how the shoulder joint moves. So for someone who has a restriction in flexion, and so typically you'll hear people say, oh, extend the arms overhead.
Yeah.
But that's not actually the movement, it's actually flexion.
Okay.
And because we're reducing the joint space.
In that pose.
In that pose, whenever we move our arms overhead into flexion, we are actually closing joint space.
So what's extension of the...
That's a great question. Extension is moving the arms behind the body. So you think Purvottanasana, reverse plank. I think Gomukhasana,
right.
The lower arm is an extension.
Or putting the arms, this.
In reverse Anjali Mudra.
Okay.
Anjali Mudra behind the back. Yes,
okay.
That's extension.
Okay, so we're in flexion in dog pose, and then what were you talking about the limitation?
Okay, so not only are we in flexion, but we're also in weight-bearing flexion. So as your mama likes to say, it all comes out to gravity.
Right.
And range of motion and really looking at your students not as an expression of Adho Mukha Svanasana, but as individuals is profoundly important because the maximal range of motion in terms of flexion for the shoulder joint is 180 degrees.
Okay.
So if you visualize a circle, it's 180 degrees. And part and parcel of that 180 degrees, you also need extension in the superior thoracic spine. So that means that from thoracic number 1 to 3, your thoracic spine needs to move with your shoulders.
Okay, so the upper thoracic spine is doing a back bend.
Correct.
Okay.
Correct. Not a huge one, but it's a necessary component of the joint movement. So first we need to look at our students. And so what I always request is I have folks show me Urdhva Hastasana first.
Mm-hmm. So this.
Correct.
Okay.
So if the person can easily take their arms into flexion with the upper arm bones aligned with the ears, then I'm pretty confident that they can also perform that action when they're weight bearing in downward facing dog.
Right.
But not everyone can.
Okay.
In particular, you want to look at the width between the person's hands. When they take their arms up, in order to achieve full flexion, do they have to separate their hands?
Mm-hmm.
Because, how are they finding the movement? How are they finding that range? So I check them first in a non-weight bearing position. And then when we move into downward facing dog, I look at the relationship between the shoulders and the wrists, the kinetic chain.
Mm-hmm.
So sometimes folks are, they're kind of like a dog sticking their head out, or they're like a turtle sticking their head out of their shoulders. I'm not a walking x-ray machine yet. Maybe in my next lifetime, that will be a city that I develop. So I have to then assume that there could be something going on in the joint, or it could be something muscular that's affecting the range. And I always check the position of the shoulder blades.
Okay.
Okay? Because the shoulder itself, the joint isn't just where the arm bone meets the side of the body.
Right.
Okay? The key to the shoulder joint is actually the scapula, the shoulder blade.
Okay.
So the joint concavity, the depression, which receives the convex head of the arm bone, the humerus, is actually formed by the lateral shoulder blade.
Okay, which means the outside shoulder blade.
Correct.
Okay.
Correct. So the position of the shoulder blade in relationship to the rib cage that's what you want to look at.
Okay.
Okay, so is the person unable to elevate, protract, and rotate their shoulder blades because there's some inhibition in the relationship between the shoulder blades and the rib cage?
Right.
Is there muscle weakness or tightness that is inhibiting that movement?
Could it also be, like you said, could it also be that their upper thoracic spine is not willing to backbend?
Yes. Or is there something going on with their cervical or superior thoracic spine that's affecting the shoulder as well?
Right.
So if we now come back to that question to externally or internally rotate.
Yeah.
We answer that question based on the range of motion that we observe. So a person who cannot come to plus 150 or 55 degrees, so almost full range, they don't have the mobility within the joint itself, in the glenohumeral joint.
Right.
To internally rotate safely. Okay?
Okay. So what's going to happen if they internally why not?
They're going to write that check, if you will, with their rotator cuff.
Got it.
With soft tissue.
Okay, so this is so fascinating. So 180, just so I understand, 180 is all the way up?
Correct.
And what does 150 look like?
Right about nose level.
Okay, yeah.
And you'll see it in your students.
I've had those students.
Yeah, you look at the relationship between their ears and their upper arm bones.
These are often, not always, but they're often called man students.
Muscularly bound.
Yeah.
Yeah, they may be muscularly bound. They may have fascial bind. Yeah. But typically it's someone, and I myself have linebacker shoulders. but I'm also hypermobile.
Yeah.
So you'll see it with students who tend to have more muscle tissue, more body tissue in the upper traps, in the lats,
Okay.
in the axillary region.
So that student, it's okay, it's in Mary Richards endorsed, for me to say to that student who's limited in flexion to externally rotate.
Correct. Correct. And the way that you want to, and this is my opinion.
Yeah.
Okay. So you want to really look at their hand position.
Okay.
That person, first of all, they need to have a correct width of base between their hands. It's not so much an issue with male students because they tend to be more willing to take up more space.
Yeah.
Okay, this is just something I've observed.
Psychologically, it's true.
Correct. Yeah. So more of a scaption hand position, a slightly wider than shoulder width, not way out here, but just slightly wider will often help facilitate their range.
Okay.
But what you'll see with women on the mat is they tend to be crunched. And so the typical instruction is that you line up the middle finger with the center of the shoulder. And I believe, Lizzie, that this is too narrow for the overwhelming majority of people.
Wow.
I am a super freak in terms of my mobility, but you can see how I can cup my outer shoulder with my index finger and my thumb.
Right.
That slightly wider hand position will then allow your students to recruit more of the pecs.
Got it. Yeah.
They'll have more anterior support for the joint, which is so important because it's the anterior aspect of the joint that is most vulnerable.
Okay, so when you said you're writing the check with your rotator cuff, that's a tear in the front of the shoulder?
Often. So the most common injury, you have a little roof on your shoulder called the acromion process, and you can palpate it. You can grab it with your thumb and your index finger, and you can feel this little beak, shall we say.
Yeah.
Well, under that beak, there is a tendon called the supraspinatus. And
I've heard of this tendon.
And it is, I believe, well, it's not even I believe. This is, you can look it up. It's the most commonly injured muscle in the rotator cuff. And I actually have a name for this. I call it yoga shoulder.
Tennis elbow and yoga shoulder.
Yes, because what happens is the supraspinatus will get entrapped between the head of the arm bone and the acromion process. And that can, first of all, the compression is painful, but it can also cause fraying and tearing. So for someone who does not have 180 degrees of shoulder range, if they are, let's say, at the typical 155 zone, if they internally rotate, they're going to entrap their supraspinatus.
Okay, got it.
But if they've got 100, and here's the other side of that though. If they have full range,
so this is a very different student. This is student B.
Yes, and this is why these generalized instructions of externally rotating and pull your shoulder blades down, we haven't even gotten to that yet. That's why these instructions carry a level of risk that I would like to reduce through education.
Yes.
Okay. So now if you've got your student who, your flexi bendy yoga student who has that full 180 degrees, if they continue to externally rotate, well, they're going to entrap their supraspinatus. Okay? Because if you have 180 degrees of flexion and you continue to externally rotate, you yourself were describing this when we first started talking, you can feel that crunch and that crowdedness. And that's because you're no longer using the law of concave convex motion to provide optimal position for the joint itself. And you're also relying improperly on connective tissue structures to move the joint. Does that make sense?
That makes a lot of sense. So what I'm hearing you say is you have to diagnose quickly the student, and there is actually a sort of paradoxically opposite instruction that different bodies need. So for the student who's very bendy, who doesn't need to externally rotate anymore,
yes.
What are the kinds of things that you say that doesn't freak them out? Because for 5 years they've been going to vinyasa classes and they've been hearing this, and suddenly you tell them, what are the kind of things you say?
So the first thing I do when I see, and it's really not, and I just want to take a couple steps back to the word diagnosis.
Right. That's
okay.
No, that's a good point.
It's an observation and an assessment. It's right. Okay.
Because we're not doctors.
Correct. We're not doctors. Though sometimes I play one on TV.
It's a quick an observation, looking at the body, and then assessing.
First, for the person that has the full range of motion, check their hand position. Okay, so for the person who does not have the 180 degrees, I want to see their hands turned out just slightly, not like a duck, but I want a slight turnout in the hands to set up some external rotation in the shoulder. But for the person with the full 180 degrees, I want their middle fingers pointed directly forward.
Whoa.
Yes. So that's the first thing I say. I say, I would like you to try something different today.
Okay.
I'm observing that you have a lot of range of motion in your shoulder, and I would like to actually explore a different sensation in the pose for you, rather than exploring mobility, which you already have a PhD in. Let's explore stability. Let's explore abhyasa. And so first, change the position of the hands so that the middle fingers are pointed directly forward.
Right.
And then, we go up in the pose. And then once they're in full 180 degrees flexion, I say, now, press down into the base of the thumbs and the base of the index fingers. Press into the thumb side of the wrist. And notice how the arm bones move toward neutral.
Okay.
And the universal response, and I can honestly say this is universal, has been, oh, that feels so much better.
Right.
And inevitably, what happens just with that adjustment of the hand position, the head of the humerus then moves deeper into the glenoid fossa. Okay,
so it's more stable.
It's more stable. So not only do they have more bony congruence in the joint that better distributes load, they also then have less muscular interference. So the muscles fire more efficiently and efficaciously. And inevitably what happens then, their shoulder blades move toward the base of their skull, move away from the spine, and the inferior angles, the bottom tips of the shoulder blades, rotate upward. And this is exactly what we want whenever our arms are over our head. And especially when we're weight bearing, we need the joint concavity, in the case of the shoulder, the glenoid, oriented toward the head. We always want the joint concavity oriented in the direction of movement.
Mary, this is so fantastic. I'm feeling myself feeling a tiny bit overwhelmed. So I think we're going to move towards closing here. You are such a waterfall of knowledge. You're not a fountain. You're a waterfall.
Well, I am a Cancer too. I am a water sign, so.
No, but what I'm gonna take this in, and I'm gonna practice from it and start teaching from it, experimenting when I see students that fall into these two categories. And to summarize, what I hear you saying, which is so valuable, is to assess where they are, and then the first point of intervention is to look at the hand position, the width, the rotation, and let the rest of the alignment grow from there.
Yeah, because in downward facing dog, the wonderful thing about Adho Mukha Svanasana is you have grown an extra pair of feet.
Exactly.
That's what the hands are. The hands are another pair of feet. And just like in Tadasana, you look at the feet.
Mm-hmm.
We want to look at the hands, especially because the hand, the wrist, the shoulder, these aren't structures that are really designed to bear weight. It doesn't mean that they can't bear weight, but it's not their structure.
Right. It's not their primary dharma.
Correct. And the thing about the shoulder blades, allowing the shoulder blades to move toward the head and to rotate upward, we have a bias within the yoga teaching community that keep your upper trap soft.
Yeah.
Why do we not want to work this muscle?
I don't know.
The dharma of the upper traps is to elevate.
Mm-hmm.
And so we want to use the muscle in the plane in which it lies, doing what it does.
I cannot wait to take your course, Mary. It's going to be so good for my teaching. It's going to be so fantastic to learn more from you. So if our listeners, our viewers are feeling the same way, I really want to encourage you to go to experientialanatomy.yoga, and you can give your email address and you'll stay in the loop and you'll get all the pre-sale pricing for the course, which is coming out next year. All right, darling, I'm sending you a big namaste.
Right back at you.
Across the skies.
Thank you, Lizzie. Thank you.